Hello. I have a pre-written speech because the time is limited and there's many things I want to include. So just about our organization, we were founded in 2001 and we are focused in changing the discussion and policies related to drugs. So the topic is the future of Finnish drug policy. Finland needs a new drug strategy and a new drug policy. Our current drug policy is largely based on a drug strategy formed back in 1997. Though progressive for the time, a large part of that strategy is no longer up to date. Since its publication, we've seen major changes in drug use and international drug policies. The use of all drugs has been on a steady rise. As the internet has become a part of our everyday lives, the availability of all drugs has also been on a steady rise. Dark web drug markets keep making it easier for an increasing amount of people to get hold of an increasing variety of drugs. Since 1997, we've seen major developments in the field of drug policy. Portugal has demonstrated that the decriminalization of the use of drugs can be done in a sustainable way and that it can help in reducing many drug-related problems. We need to look at drug use from the perspective of social policy and healthcare instead of criminal policy. This shift in perspective makes it a lot easier to offer help to those in need and to build trusting relationships between drug and mental health workers and people who use drugs. In addition to decriminalization, we've also seen an increasing amount of countries adopt services such as drug checking programs and supervised consumption rooms, which have proved to be effective in mitigating drug harms. Current Finnish drug policy makes it difficult to experiment with these kinds of harm reduction measures. Their implementation needs to be made easier. Today, it is becoming ever more clear what prohibition actually means. Prohibition means that drug markets and the enormous amount of money that they create are in the hands of organized crime, which uses that money to finance other kinds of crime. It's quite understandable why more and more countries and states have now either created a system of legal availability for cannabis or are planning to do so. A lot has changed and is changing. What we knew back in 1997 won't be enough to guide us through the challenges we're facing today. What we need in the center of our drug policy is care based on science and awareness of the best available practices. Currently, parts of Finnish drug policy are supportive of that. We do have treatment and rehabilitation programs, needle exchange services, and substitution treatment. But many people are definitely lacking sufficient treatment and support. Too many people are left to stand alone. And of course, many people are being punished for using drugs and face the threat of getting kicked out of their job or school for getting caught, or even losing custody of their children, regardless of how good care they take of them. It doesn't really matter that these devastating consequences might not be very likely for any given person. Just the threat that they present is enough to cause people distress. This threat also deters people from seeking help, and if they eventually do seek help, even medical records related to drug use can cause them problems. It's not just the legal status, it's also the stigma. Much of this is caused by policies that are not justified by scientific research, but are in fact in direct opposition to recommendations based on the best current scientific understanding. And, of course, the negative consequences of those policies tend to stack on the most disadvantaged people in our society. This spring, a new parliament was elected in Finland. We now have a government more left-wing than in ages. Some might assume that such a government would understand the need for more and better care for people who use drugs, though a sustainable drug policy reform, of course, needs support from all sides of the political spectrum. People with problematic drug use tend to be traumatized, often early in their childhood. The use or abuse of drugs is often not the root cause of their problems, but a symptom, possibly a way to try to manage those problems. It is unclear what the new Finnish government is going to do, but currently there is talk about a new strategy for psychoactive substances. Whether this will only cover the legal ones or also the illegal ones, whether the questions of policy related to illegal drugs will once again be dealt with silence or met head-on, is hard to say at this point, because as of now, the government hasn't really discussed the topic in public. Experts in Finland, this including drug workers, drug researchers and drug users, have been getting more vocal about the need for change. Public support for decriminalization is increasing, but at the same time, there also seems to be an increase in people who want people in jail for drug use. It's hard to say where they think the money for that would come from. Not from my tax money, I hope. These are challenging times, and there is a lot of work to do. Luckily, we have Norway and the larger international community leading the way towards a more responsible, safer and saner drug policy. Thank you.